So today I want to talk to you about dizziness and how it can come from the neck. So your brain receives three different types of information from three different systems to help coordinate a balanced body or a balanced state. If any one of the three systems are off, then the information going to the brain can create confusion and therefore it manifests as vertigo or dizziness. These three systems are your visual system, your vestibular system, which is in your inner ear, as well as your proprioceptive system, which we don't really talk about too much. Now, before I go talking about how dizziness can be originated from the neck structures, let's explain proprioception first. So simply put, proprioception is just your body's awareness in space. To illustrate this, and know that your proprioceptive system is working. If you closed your eyes and I were to move your arm out to the side like this and you kept your eyes closed and I asked you where your arm was, you would know. And that means your proprioceptive system is working. So your proprioceptive system is made up of little receptors throughout the body. They're located in muscles, they're located in tendons, ligaments, joint tissue, and this sends information about movement back to your brain. So they're literally the eyes internally in your body. Now for this example, I'm going to touch on one type of receptor specifically, and that's located in the muscle called muscle spindles. Now, these muscle spindles are in muscles throughout the body, but they're highly concentrated along the spine. And they're more concentrated in small muscles that aren't really prime movers of the body. Now, specifically, the highest concentration of these muscle spindle receptors are in the base of the skull or the top of the neck around the first two vertebrae in the cervical spine. This region is called the suboccipital region. And on your left and right side, you have four muscles that are these little tiny muscles that make up your suboccipital muscles. To get an idea of how concentrated these receptors are in these tiny little muscles, there was a study done that compared how many receptors or muscle spindles there were in one of the suboccipital muscles compared to other muscles throughout the body. And if you compared it to the amount of muscle spindles in the trap muscle or the trapezius muscle, which is a big prime moving muscle, there was about 170 times more muscle spindles per gram of muscle tissue in this little tiny muscle in the base of your skull compared to this big prime moving muscle in your back. So with that information, we can discern that this is a very important area in the body related to proprioception and how your body moves in space. So dizziness doesn't happen just because you're getting information into the brain. It happens when aberrant information is going into the brain. So when one of the signals from either your vision, your vestibular system, or your proprioceptive system is incongruent with the other two, your brain gets confused. And it manifests, like I said earlier, as vertigo or dizziness. Now, a really simple example that most people have experienced, if they've never really experienced true vertigo before, would be if you're sitting on a train and it hasn't left the platform yet, and if you're looking out the window and another train goes zooming past you in the track next to you, you get a moment of uneasiness, right? And the reason why is your proprioceptive system, so the little receptors in the body are telling your brain that you're not moving. Your inner ear is telling your brain that you're not moving, but your visual system is saying, we're moving and we're moving fast. And until that train passes, you get a little bit of an uneasy state. And this elicits a very small bout of vertigo or uneasiness. Another example would be if you have positional vertigo. So BPPV is a type of positional vertigo that's pretty common, and it's characterized by a crystal that forms in the inner ear. So if you've had this, you know that this vertigo can be extremely debilitating and unpredictable until you realize the pattern. And the pattern is if you turn in one direction, usually when you're lying down, it will elicit these vertigo type symptoms. And that's because the crystal moves a certain way in the inner ear and it stimulates the little hair follicles which tell your brain incorrect information to what your body's doing. So if you turn to the right when you're lying down and that elicits vertigo, your vision is telling you that you're turning to the right. Your proprioceptive system is telling you you're turning to the right. But the little crystal in the inner ear is irritating the inner ear a little bit and telling your brain otherwise. So the same can happen with the upper neck. And if the upper neck is sending aberrant info back to the brain when the other two systems are telling it the correct info, you're going to develop a state of low-grade vertigo or dizziness. And this is common. I see this a lot in people that have come to the office over the years, and they present with a very similar story. And it usually goes something like this. They start with a little bit of vertigo, and then it develops into more of a chronic nature. They seek out tests and treatment from specialists, and the neurologist and their GP usually says, let's go do some tests. Everything came back normal. The CT scan comes back normal, and the MRI comes back normal. So they're told nothing is really wrong with them. They can't figure out why they're having this vertigo. So they're given a prescription or medication to help alleviate the symptoms, but yet they're still seeking answers. And they usually come to us as a last resort. And the first thing I ask is, did anyone test your neck? And immediately they usually say, no one looked at my neck. And they're kind of look at me perplexed because they're saying this is a head issue, it's a dizziness type issue. So as soon as you touch the upper neck in that suboccipital range, usually this elicits some tenderness and sometimes some pain. So what would cause the neck in that proprioception, the suboccipital muscles, to be irritated or strained? Well, there are a few different reasons, but some of the more common reasons would be related to osteoarthritis, a shift in the atlas, which is the top vertebrae, which can be pulling on the structures of your neck. There could be a structural change, so that C curve in your neck could go either straight or it could lose its curve and reverse the opposite way, putting a lot of strain on those structures. Or it could just be a repetitive strain that you're putting yourself in every single day, like sitting on a computer looking down, or for kids and adults as well now, looking at a tablet, looking down, or texting all day on the phone. So that constant strain to the upper neck can cause incorrect information to go to the brain, and it can elicit some of these symptoms. So what I do is create a plan and work with these people to alleviate what's causing the strain to those structures in the neck in the first place. Now, you are probably wondering, if you go through chiropractic care and the vertigo is still happening, then all that means is that one of the other systems contributing to your balance is compromised. So that could be your visual system or your vestibular system, and then more tests would be needed by specialists in that area. So I hope this helps you guys understand better why vertigo and dizziness can come from the neck. If you have chronic vertigo and you can't develop answers, you really need to go and get checked by a chiropractor to see if there's anything they can do. And a simple test you can do at home is just palpate underneath the base of your skull. And if you notice tenderness, or you're also getting these tension headaches that are related to that area back there, then you definitely should seek out some testing and maybe some care from a chiropractor.